Boonville resident Debbie Davis has been a customer of Medical Arts Pharmacy for years.
It's always been a family affair, and to me that's important because I think they really care about the community. I'm not a big fan of Walmart, so I would much rather do business with Medical Arts Pharmacy.
Ann Bromstead, co-owner of Kilgore's Medical Pharmacy, says that independent pharmacies are more accessible.
We just had a customer from a different big box store transfer to us. They were waiting for their blood thinner, which was pretty emergent because they'd just gotten released from the hospital. They were due for their dose. They waited for 2 hours in that pharmacy. Finally, they said, transfer it back to Kilgore's.
Pharmacies have seen a steady rise in the cost of generic drugs. Bronsted says her pharmacy can cover these inflated prices because they're bigger, but that may not be the case for many small pharmacies.
Say if you were a smaller store, problem that you run into because of the fact that the pharmacy benefit managers, aka insurance companies, don't pay you for sometimes up to 3 months.
According to Missouri Pharmacy Association CEO Ron Fitzwater, both big box and independent pharmacies are under pressure from rising generic drug prices.
Yeah, it's more the pharmaceutical industry, even the big box, the chains really can't leverage the price of drugs. So they're a victim sometimes of the system, same as the independents are.
Drug prices and reimbursements are typically handled by pharmacy benefit managers, who serve as middlemen between drug companies and pharmacies. Independent pharmacy owners say that these groups are not efficient at reimbursing their costs. Medical Arts Pharmacy co-owner Tim Smith says this makes it hard for independents to survive.
We have to wait for them to pay us, and sometimes depending on if it's a busy season like the fall or the flu season, you'll sell more medicine and wait for your money, but you got more money out there that you're waiting on.
To remain competitive, some independent pharmacies are adding immunizations and comprehensive medical reviews.
As reimbursement for the product continues to be squeezed, pharmacists are finding that they have to be more involved in patient care.
Independent pharmacies are trying to develop deeper relationships with doctors and health insurance companies to ensure that patients are being properly cared for.
If you take care of their patients in a good way, then that nurtures that relationship even more. At times they'll say, no, I'm not going to change, and they can go get it somewhere else. Or they'll say, yeah, we'll figure something else out. We'll send you an alternative to dispense to them that's more affordable for everybody.
Fitzwater says that pharmacies need to let go of the past or may risk their survival.
And we can't recreate the 80s and 90s in pharmacy as it used to be, but we can help build systems that will help pharmacists that want to transition into this new environment.
In rural areas where there is a need for more patient care, some pharmacists are forming new and deeper relationships with their customers to fill those needs. With producers Anoganich and Manyon Zhu, Kevin Henderson, KBIA News.